like it.
Good afternoon, everyone. Hi there. We're going to start. Hi, aloha, mai kako. My name is Mike Kaneshiro, and I am a dual degree master's student here at the Harvard T.H. Chan School of Public Health, master's in public health and master's in urban planning at the Harvard Graduate School of Design. I'm so honored to be here today to present the next panel because this topic of mine that we were talking today holds a lot in my heart because in 2016 in the state of Hawaii, we took a seemingly small, significant step by passing a law barring insurance companies from discriminating against residents based on their gender identity. We were part of that fight, and to lead the changes to the state to this day. And I just want to say that this discussion means a lot to me. I am excited to introduce this first panel, Advancing Transgender Health, Overcoming Barriers to Care. And we have some amazing panelists joining us for the conversation. Dr. Brittany Charlton is Associate Professor in the Department of Epidemiology here at the Harvard Chan School. And our three esteemed panelists are Jason Rafferty, Clinical Assistant Professor of Pediatrics and Clinical Assistant Professor of Psychiatry and Human Behavior at Brown University, Sam Montaño, State Representative of Massachusetts, representing the 15th Suffolk, and Matthew Mimiaga, Professor and Vice Chair of Epidemiology of UCLA Fielding School of Public Health and Psychiatry and Biobehavioral Sciences at UCLA David Geffen School of Medicine, and the Inaugural Director of the UCLA Center for LGBTQ+ Advocacy, Research, and Health. Without further ado, please take it away, Dr. Charlton.
Great. Thank you so much, Mike. So welcome to our discussion on healthcare barriers impacting transgender and non-binary communities. We know that gender-affirming care is life-saving and that this care is really in jeopardy with bans that are really spreading like wildfire across the US. Now, we've gathered this esteemed panel to address some of the challenges and opportunities in this field. When discussing gender-affirming care, what we mean by that is care that's designed to support and affirm a person's gender identity when it's different from the sex in which that person was assigned at birth. Now, gender-affirming care is not a single category of services, but includes mental health, medical care, legal support, and social services. That care can range from a simple discussion about a person's pronouns and affirmed name to non-surgical medical management and sometimes surgery. Now, it's important to remember that there are very clear, well-established, evidence-based standards of care for patients of all ages. And this panel brings together experts who really dedicated their careers to improving the health and well-being of trans communities. And I'm so glad to have representation not only from researchers like Dr. Mimiaga, but also legislators and also healthcare providers when Dr. Rafferty joins us as well. Now, before we begin, we are happy to include a video message from Senator Ed Markey of Massachusetts. Senator Markey has been a tireless advocate of the LGBTQ community, and while he couldn't be here with us today, he recorded this message.
Hello, everyone. This is Senator Ed Markey of Massachusetts. Thank you to the Harvard Chan School of Public Health for hosting this important panel on health equity and justice for trans and non-binary individuals for their alumni weekend. Thank you. This is a time when there's no question that transgender and non-binary people across America are under attack just for being who they are. We will not have true health equality for all until we have eliminated the health disparities trans and non-binary people face. Members of the LGBTQ community of all ages, but particularly trans youth, have been under escalating attack by right-wing extremists. Over 500 anti-LGBTQ bills have been introduced across the country, and over 75 have been enacted into law. That is unacceptable. And in the face of this hatred and bigotry, we cannot agonize. We must organize, defend, and expand the fundamental rights of LGBTQ people against violence, discrimination, and bigotry. We must protect the life, the liberty, the health and safety of every American. We must build the political will in Congress to do this. And that is why I introduced the Trans Bill of Rights to recognize the federal government's role in protecting and codifying trans rights and to ensure access to gender-affirming care. And that's why I introduced the Gender Affirming Care Act to fund research at the National Institutes of Health and Centers of Disease Control Prevention to study barriers to gender-affirming care and the impact of these barriers on health outcomes. Help to ensure that everyone understands better all of the obstacles standing in the way of this essential medical care so that we can dismantle them. Gender-affirming care is healthcare, and healthcare is a human right. Trans rights are human rights. LGBT rights are human rights. I look forward to continuing to work alongside the trans and non-binary community to protect these essential rights and secure true equality and justice for everyone. Thank you all for everything that you are doing.
As the senator spoke about, trans people, and particularly youth, have really become the target of an utterly unprecedented wave of policies across the US. These policies include those that limit access to healthcare and even those that criminalize teachers for just discussing the existence of LGBTQ people. Now, even before this rapid increase in discriminatory policies, LGBTQ individuals were disproportionately burdened by adverse health. But the threat and enactment of those discriminatory policies is certainly widening those disparities. Now, in addition to this wave of discriminatory policies, we're also seeing another completely unprecedented coordinated attack on clinicians who are providing gender-affirming care, as well as LGBTQ researchers like Dr. Mimiaga and myself, legislatures, and I know many, many others. Now, this stochastic terrorism is akin to what we've seen for decades in another area in which I work, and by that I mean the harassment, violence, and execution of abortion providers. Now, I want to open by asking each member of our panel to speak to what you each see as some of the primary challenges around healthcare for trans people. So, Dr. Mimiaga, would you mind kicking us off? What do you see are some of the primary challenges around healthcare for trans people?
Sure. So transgender individuals often face unique challenges when it comes to accessing and receiving appropriate care. Although, recent data from the TransPop survey conducted at the Williams Institute at UCLA, which is the first of its kind to provide national representation, revealed a relatively high percentage of transgender individuals having healthcare coverage. So approximately 90% had healthcare coverage. Significant number of them reported avoiding necessary medical care due to financial constraints. So specifically 33% of those people disclosed that they had refrained from seeking healthcare in the past year due to cost. And in contrast to only 15% of individuals, their counterparts. So despite this 90% of people having insurance coverage, for transgender-related healthcare varies widely, and many insurance plans may exclude or limit coverage for gender-affirming treatments and procedures. So this can create, financial barriers to accessing necessary care, and oftentimes necessitates paying for ongoing care out of pocket. So, for example, many families struggle to afford puberty blockers, and others, have difficulty seeking a trans-friendly provider in network, or a healthcare provider who offers specialized transgender healthcare services, such as hormone replacement therapy or gender-affirming surgeries. So, these lack of these essential services can lead to delayed or inadequate treatment, negatively impacting the physical and mental well-being of transgender individuals. And access to mental health services that are knowledgeable about transgender issues is crucial, but can be limited. So this is, particularly concerning as transgender individuals experience higher rates of mental health issues such as depression, anxiety, suicidal ideation, and they often face stigma and discrimination within healthcare settings. So, this can deter them from seeking care or disclosing their transgender status to providers. Some healthcare providers may impose unnecessary obstacles and requirements before, providing transgender-specific care, and this can involve subjecting individuals to prolonged waiting periods, extensive, psychological evaluations, or approval from multiple providers. And these practices, often rooted in transphobia, contribute to delayed access to necessary healthcare, causing distress, potentially worsening health outcomes. And so, the overall institutional transphobia that patients experience is profound, and it can lead to delayed diagnosis and treatments, increased mental health challenges, and higher rates of substance abuse, and increased risk of self-harm and suicide.
Great, thank you. Let me go down the line here. Sam, what do you see as some of the main challenges?
First, I want to say I went to UCLA, so that's Royce Hall behind you. I think. I don't remember now. But I think the other thing is just listening to that. Those are a lot of experiences that I've had. I'm non-binary, and when I go to the doctor, sometimes, before, even in the legislature, sometimes I'm living paycheck to paycheck, right? And if I go somewhere, I want to be able to, maybe it's taken me a few months to work up to making that phone call to schedule my appointment, or I can't even tell you the last time I went to the dentist because I know that that's expensive. And that's like a side cost. So being able to respond in an equitable manner means having the space set aside for folks who come in who haven't been to the doctor in 20 years, made that call, scheduled the appointment, got in, and now they're hearing the litany of issues that they've fallen behind on and need to kind of respond to in rapid succession. Otherwise, you're going to lose them somewhere along the journey. And part of healthcare is understanding, I think, and part of responding to that in the legislature, and when I get phone calls from constituents looking for support in that, is saying, okay, I'm going to be here to walk you through all these processes because I know that they're, that maybe because of the way that you've been functioning, their stress levels, the way that your brain has rewired in the last couple of years, you're not going to be able to push yourself through this successfully without some support. And that's what we're here to do, is to make sure that you're getting the next appointment, you're showing up, you're able to get to that next appointment, you have transportation, you have money to get on the train, you have your healthcare in place. You don't have healthcare in place, what's wrong? You missed that letter, let's follow up. And I think that those are things that impact, folks of color, low-income folks across the board, but especially if you're in a position where, even in Massachusetts, that being a trans non-binary person is something that is a holistic part of your identity and a whole part of yourself and how you see yourself whole, but you're not sure how other people react, or you project how other people react onto the medical setting. So having those community supports, having those buddies, having those systems in place. And I think we do have those here and there, but we definitely don't have them to the degree and to the number that need to be had in order to begin to really address the health concerns in this community and my community.
Great. Dr. Rafferty.
So the biggest challenges?
Yeah, biggest challenges you see around trans health. It's a big one.
I have a number of different roles. I'm a pediatrician, also a child psychiatrist, so I'm working with a lot of patients, young patients, adolescents, young adults in my practice, but I also work with the American Academy of Pediatrics on a lot of policy work as well. And so I think there are a lot of systemic issues that I think are really sort of relevant. The biggest, I think, being misinformation. There's a lot of I think play on words. There's a lot of real sort of fear, building, sort of being presented among those who are sort of trying to, coming at sort of an anti-trans sort of perspective, anti-LGBTQ, more maybe even at times more conservative. And I think unfortunately that plays down. Even if it might be happening on the other side of the country, we see how it influences kids every day in my clinic. I'm in Rhode Island, so I'm not that far away, a relatively liberal state. And so I'm fortunate because we have a lot of supports, but still we see people coming into the clinic. I had a patient not that long ago who was running track, and she's a trans girl exploring her gender. And at the track meet, she noticed people were taking pictures of her. A few days later, those pictures ended up on TikTok. Were being shared. People then, across the country, across the world, are posting comments, and very quickly, what was seen as a pro-social, relatively, really, healthy activity, running track, doing physical activity, now has turned into something where, the amount of sort of comments, bullying, online bullying, the things that were being said, just how vulgar and vile they were, turned into something that really was incredibly harmful towards her. And all in the context that she's simply trying to sort of figure out who she is, trying to figure out what her sense of identity is, where she fits, within the various communities that she sort of interacts with and is a part of. And so I think that that's what I see every day, is how our systemic, sort of misunderstandings and political sort of rhetoric around this actually has real life implications for young people. The other place I see it a lot is with parents who come in and they're asking questions that often are just show sort of where they're getting their information. Usually it's offline. Coming in, asking, first of all, coming in with a sense of skepticism, I think, towards healthcare providers, that we're not there necessarily for the good of their children. We're not there because we want to help. We want to, for, the health and, sort of development of young people, but that we're there because we have a political, agenda. And obviously, if you stand behind evidence-based medicine and science, that, somehow that is maybe a more left-leaning or more liberal sort of, political stance. And so all of a sudden, where before I felt like I could even, pre-COVID, I felt like I could have an open conversation with a lot of parents, just sort of talking through value, their values and where that sort of lands with treatment options available or ways that they could be more supportive. Now we have this extra layer that the parents feel that this is a political conversation, and we're debating, sort of a political debate, and bringing in sort of all or none, beliefs around this. That if they use their child's asserted name, that's going to then lead them, down a road to surgery. And it's like, well, that's, I have a lot of patients who don't go forward to surgery, and they're looking for, affirmation. They're looking to sort of figure this out. One does not necessarily lead to the other, but the parents are scared, and they get these messages, and that fear and that skepticism, I think, really gets in the way of having sort of honest conversations. So I think one of the things that we've been trying to do a lot with the AAP, and even as a provider, is really trying to clarify the messages that are out there, trying to clarify it for pediatricians, but also, and more importantly, trying to clarify it for families, so that when they come in, they can understand, even small things that they can do to be more affirming and supportive. The research really shows that actually makes a real huge difference in terms of building resiliency and decreasing adverse mental health outcomes. So I think that's sort of the biggest thing that I see, and I think kind of bringing together some of what was already said, from the systemic stuff to the personal.
The media really is a huge barrier right now, and I spend a lot of time dispelling incorrect information or not complete information. It's been very hard myself. Yeah.
Can you give us an example of where that has come up for you that still feels very salient?
Well, I watched the Republican debate earlier this week, and I watched Fox News, and the messaging that was coming up on all the commercials I was seeing, the way that folks were asked these questions about, would you implement a trans ban? Would you implement? And these are things that are on TV. So if you're a young person, if you're a young person whose parents are watching this, the message you're getting across the board, because all the candidates are scrambling to implement a trans ban, is that you're a problem, you're not wanted, and in fact, if any of these folks are elected, we're pretty much we're screwed. We're in big trouble.
Yeah. I had a kid the other day too say they were afraid to come out to their dad because they were afraid they were going to get kicked out of their home. And when we were talking about this in the clinic, Dad was there, and Dad's like, "Why would you ever think that? Why would you ever think that I would do that, to you? I want to be supportive."
We can't hear you in the back.
Thank you. Yeah.
Oh, sorry about that. So it was a young person who was coming out to their father and worried that they were going to get thrown out of their home if they came out. And the dad was like, "Why would you worry about that?" And the young person's like, "Well, I thought that's what happens to young kids. I thought that's what happens to trans kids. That when you come out, their families throw them out, because that's some of the messaging that they've been seeing, and some of the stories that they've been hearing that have really been out there on, again, TikTok or social media, things like that. They hear about this happening in other parts of the country, and they really worry that it could happen in their own homes."
Great. I know many of our audience members were with us last night and thinking about our panel around racial justice. So I now sort of want to turn our attention to thinking about ways that you all see sort of intersecting identities, whether that's, race, age, incarceration status, any number of other social identities. How do you see that compounding the healthcare challenges that are faced by trans people? And I know that's one area certainly that Dr. Mimiaga focuses a lot on his research. So I wonder if you might take that question first.
So yeah, these factors definitely intersect and interact, leading to unique barriers and disparities in the healthcare system. Transgender people of color often face multiple forms of discrimination and marginalization, which can exacerbate healthcare disparities. So racial bias and discrimination within the healthcare system can lead or can result in inadequate access to quality care, mistrust, and disparities in treatment outcomes. Can also contribute to higher rates of poverty and limited access to health insurance among transgender people of color, further, hindering their ability to access necessary healthcare services. So due to the already existing higher rates of, say, suicide among the transgender population, in comparison to their cisgender peers, being Black and transgender may make a young person more susceptible to negative experiences of chronic stress stemming from multiple marginalized social statuses. So Black, transgender, and non-binary young people, report higher mental health problems compared to their Black peers. This includes reporting, more than double the rate of suicide attempts in the past year. And, transgender individuals across different age groups also face unique challenges. So older transgender individuals may, encounter age-related health concerns such as, hormone therapy management, chronic diseases, and other age-related surgeries, which may require specialized care. And older transgender individuals may face additional barriers such as lack of social support networks, limited access to transgender affirming healthcare providers. And then with respect to incarceration, often those who experience incarceration have significant health challenges, and they're likely to face violence, harassment, inadequate access to gender affirming healthcare while in custody. Many correctional facilities do not provide appropriate medical care for transgender inmates, including hormone therapy or gender affirming surgeries. And this lack of access, to healthcare services can contribute to physical and mental health, related issues and other challenges faced, by individuals in the criminal justice system. So, overall, I think these interacting identities adds an additional layer of complexity to, the healthcare challenges faced by trans people. And it highlights the need for healthcare systems and providers to address, these intersecting identities and develop, inclusive, culturally competent, and equitable approaches to care that consider the unique needs and experiences of these individuals with, diverse backgrounds.
Great. Sam.
I think when we're legislating, it's incredibly important to be explicit when we're creating policy and legislation that encompasses the intersectional reparations we need to make or the policies we need to use to move forward. I'm the only out person of color in the legislature. The only person who doesn't fall into the gender binary. There's, I think, 9 LGBTQ legislators right now. So a lot of times when we're shaping policy, when we're making things, I'm the one bringing up in a lot of different spaces because we're all not in the same spaces all the time. I'm the one bringing up, okay, what about LGBTQ folks? What about trans folks? How does this interplay with folks of color? I'm the only person in the Black and Latino caucus who ever brings up LGBTQ folks. And then I have to then have that conversation. So the compounding identities, even in myself, trying to advocate for my community, mean that I'm the person constantly bringing these things up. And maybe I could have other legislators who are better allies who can do it too, but that's not the case. So we have to make sure that the policy that we're creating really encompasses and is explicit with how we're planning to use it and how we're planning to enact it. An example I have is in the Department of Corrections, we go to visit Framingham, which is the women's prison. We recently passed legislation that would include electrolysis for gender-affirming care for folks who wanted to remove facial hair or any other hair on their body. Appointments and wait times can be months. even though it's allowed, even though it's something we put into legislation, the DOC plays games. So then what ways then do we respond to make sure that folks who are implementing these policies on the ground level, whether it's the correction officers or folks across the board, can't take advantage of, can't input their personal views and their political bias onto the policy? How are we changing that? And that's a longer term game that I think we haven't quite addressed, because I still have to get on the phone and say, why hasn't this person gotten their doctor appointment? Why haven't they been able to go to urology to see the doctor? Why are you continually delaying? Why are they suddenly in solitary confinement when they should be going to their doctor's appointment? They have this right. This is their right. Continue to serve them. Even though they are incarcerated, they're still citizens, and we still need to provide them these services. So that's the part that I think we're still missing, is really implementing on the ground across the board. And I'm sure you see that when you're practicing as well, that not everyone is following all the best practices, all the policies. And so that's a conversation I think that I haven't quite figured out without, being a fascist and brute forcing it on people and recording them, right? So
with intersectionality and diversity, one of the things that I've a couple things I've come to appreciate. One is that often in more privileged communities, a lot of our patients and families tend to have private insurance that they're getting through their employer, whereas a lot of in our communities of color and other marginalized communities, it tends to be Medicaid. And I think one of the big differences is not only coverage, but like if your employer is not covering something that really is important for you or your family, you can go down to HR and you can advocate. There's a lot, people really, I found, feel very empowered around this issue to raise awareness, and it's really great. But if you go and try to advocate when it comes to like public insurance, all of a sudden now it's a public debate. And that is not only incredibly daunting for somebody who's already marginalized and may already feel that they don't have a lot of, sort of social capital to be able to do that. But also it brings forward all of those sort of negative voices and really calls into question, it might be your child, it might be your, relative or your friend or something like that. And it makes it incredibly tough, I think, in terms of change. And so one of the big things we try to do as providers is to really help on that level. But I do think that it's a lot, they sort of have the odds stacked against them in that way. And sometimes it's very basic means of affirmation, not even hormones and surgery, but like access to a binder, speech therapy that might help them adjust their voice in a more sort of healthy way. Electrolysis, as you just mentioned, coverage for electrolysis is a big thing. So sometimes even some of those basic interventions that really can help affirm somebody really can be split in terms of coverage. Another thing in terms of intersectionality, another area of sort of diversity that I don't think we think about a lot is along sort of faith communities. And one of the ways that I think we've had a lot of success in the work that we've done is connecting to accepting sort of faith communities and leaders and so forth. And through doing that, we've then connected to larger communities, especially communities of color, especially multicultural immigrant communities and things like that, where the faith community is really sort of the hub of a lot of the sort of interactions, even family life. And I think that's really important. And as we do LGBTQ work, sometimes we don't think about religion. We think about it more as maybe the opposition or whatnot. But there are a lot of faith communities out there that have been doing incredible work and have been really helping in our clinic and so forth, connecting with our patients. The other thing that I think is interesting too is sometimes the shifting identities, especially when we talk about sort of gender. I've seen this sometimes with patients who will come in who has a partner who recently came out, and they come in and talk about a little bit. I used to identify as gay. Now I'm identifying as straight because now my partner, instead of being male, is now identifying as female, and it's changed the dynamic not only of the relationship a bit, but also changed the dynamic of how I see myself and the sort of communities of power and privilege that I find myself in. And navigating that, I think, has been really interesting. But it's also, I think, interesting with young people talking about this, because I think they see a lot more fluidity between these communities and a lot less distinction. And that, we are people. What separates me? I love the same person. I'm attracted to the same person. Why does this, how they identify might have a totally opposite impact on who I am? And I think they're really questioning this in a very critical and healthy way that I'm hoping could spur more sort of equality, in the next generation.
Great. So I want to make sure we have some time for audience questions. So please be thinking about them, and you can turn on your mics to ask a question. But I'm going to offer just one more question. I'd love to do sort of a quick rundown for folks, and then we'll open it up. So we already talked about a lot of challenges that we're seeing in the field, whether they're this wave of policies, this huge increase of threats and harassment, but also I know there's a lot of hope too. And so I just would love to hear from each of you, what's something that gives you hope in this field? Why don't we go to Dr. Mimiaga?
There are, I think, several things that I feel hopeful about. One would be increased, awareness and understanding. So as society becomes more educated about transgender experiences, there's a growing demand for transgender affirming healthcare and a push for inclusive policies and practices. Additionally, we're seeing more funding, which means to more advancements in research. So transgender health has made, significant strides in recent years. There's a growing body of evidence, and knowledge on gender affirming treatments, including hormone therapy and surgical interventions. And as research, continues to evolve, it helps improve the quality of care and outcomes for transgender individuals in ensuring that healthcare practices align with best practices that are evidence-based. And then also, I think there's a lot of activism in the community. Transgender individuals and their allies are at the forefront of advocacy, demanding for better healthcare for transgender individuals. And their activism has been instrumental in raising awareness, influencing policy changes and driving improvements in transgender healthcare. So, these, I think while there are still, challenges that persist, these positive developments, do provide hope for the future of transgender healthcare, with ongoing efforts to, promote inclusivity, research advancement, and policy changes, and increased awareness. So those things make me hopeful.
Great, thank you. Sam.
Yeah, I think it's mostly that. Sorry, I have allergies. I think it's mostly that folks are able to show up publicly and be their whole selves. I think there's 16 across the United States state elected officials who are trans or non-binary. And so that means that there's a group of folks who can then talk to each other, talk about what's going on. I think, we were all there for Zoe Zephyr when they were silenced by the Montana legislature earlier this year. Just being able to have that cohort and feeling like you're not alone is and having the networks to be able to raise that profile and to say, like, this is a huge injustice that's happening in this part of the country. It doesn't have to be the case across the whole country, is really great.
Yeah, I think I get a lot of hope just from the patients and families that I work with. And many of it is relatively quiet. They're not getting out there and marching and protesting and things like that. But every day when young people feel that they can go out and be themselves, that takes an immense amount of courage, and it's just amazing to sort of see that. And also the parents. Parents are coming from a place often where this is totally new to them, and to have the courage to just sort of trust your child and what they're saying, that they have some validity, that they know that they're expressing these feelings, and for parents to be there and to be supportive and open-minded. Sometimes it takes small steps to sort of get there, but I think that it's incredibly inspiring. I would also agree. I think some of the organizations there are some really great organizations out there that have been incredibly supportive. In Rhode Island, a lot of the healthcare systems have been, which has been really great to see. And we wouldn't be able to do this work if we didn't have the space and the resources for things like that. A lot of the professional organizations that are out there supporting the guidelines that are in place and the evidence that's sort of coming out, bring recognition. I think it's also equally important, to really sort of provide providers with enough education and foundation to be able to do this.
Wonderful. I know we're somewhat limited on time, but I'd love to see a hand from anyone who might like to pose a question. Okay, so I see at least two hands. Why don't we hear both questions, and we'll see which panels want to tackle which one. So why don't we start in the back?
Hi, I'm Marco Caldwell from Nashville, Tennessee. I'm at Harry Medical College now. It's a historically Black medical school. And first of all, great panel. Thank you for all the work you're doing. And I can't help but think, I was graduated in 1994 here. How far we've come is revolutionary. To think about having this panel here now, I can't imagine having had it this, but as you know, they're enemies of public health, enemies, and they are, the elections are running against Dr. Fauci and running against you. And I've struggled a little, especially being in Tennessee, because I think they have effectively seized on something that I am very uncomfortable with. I don't know how to address it, and I need help. They seized on the fact that they're protecting children because we're butchering children. And that's a very distinct visual imagery. And I get very uncomfortable with that because I'm not sure how young is too young, and I don't know enough about it. And I think a lot of us who support all of you, are trying to think, how can we engage in a way when these are things that are being thrown at us? And I need help, and I think we all need help because we all want to move the needle. But when we're being told this in such a way, I'm struggling, and I hope you can understand that it's hard. So thank you.
Great, wonderful. Was it Casey? I mean, you also had a question. Yeah, what was your question?
In a state where transgender bans came through and moved, and just as they got their kids settled, it looked like more stuff was going into that state's legislature. And that's an N of one. But it sparked in me, is there now migration of families who are scared? And are they headed this direction? And what is the healthcare system, given that there's support needed? And that going with, is a migration occurring? Other than that N of one, and how are we preparing if that's going to happen, given the quadrupling of legislation against transgender in certain parts of the country?
Okay, wonderful. Any last questions people want to insert in this? Okay, yes, I see one in the back, and I will add one myself, and then we'll go one more round through all the panelists. Yes. Yeah, wonderful. Okay, so we are touching on a lot of topics here, certainly thinking about disinformation and how to combat that, thinking about the heterogeneity across states, right, whether it's around legislation, access to care, and what that means for families moving, and also thinking about in a direct clinical context, right, like how we're gonna not only provide care to minors, but also what that looks like in a family context. I'm going to throw out one more. Again, you all have one more chance here. And what I want you all to think about in your final comments here, where you have a whole audience of people who are trained in public health and medicine, and also alums of the school. And so I would love to hear from each of you, just what can this audience do? Like, how can people get involved? What can they do to do something on the ground to actually make an improvement? So knowing all those questions, Dr. Mimiaga, why don't you kick us off with your sort of final thoughts on any of those topics?
Yeah, so I think the number one thing that people can do is, when they're seeing discrimination or, experiencing, transgender individuals being treated poorly, to speak up and to speak against that and to, support them. I think also, you can be involved with organizations that support transgender health and transgender rights. You can, give to research and support research in areas that, we need to do a lot of work in to understand, trans dynamics and, health outcomes. We don't know a lot about, older transgender individuals and aging, in areas the area that I work is HIV prevention. And so there are limited resources available in HIV prevention for the population, despite it being, transgender individuals being, the highest risk individuals, wherever you go for HIV. So I think, those are some of the things that you can do.
That's great. Sam.
We definitely are getting folks in Massachusetts from other states. Yesterday I was at Trans Health talking to them, and they've received an influx of folks. I think through a public health lens, it's great that we offer these resources here in Massachusetts, but it's detrimental because we're in a housing crisis and people can't afford to live here. People can't afford to move to Massachusetts and get a home, have access to transit, afford their groceries. And so they're coming here, and then they're starting off even further behind than they were because they're looking for the gender-affirming healthcare that they couldn't get in their own state. And now they're like priced out of Massachusetts trying to get that healthcare here. So I'm not quite sure. And we have like a influx of refugees and immigrants too. So we're trying to navigate housing those folks as well because we're a right to shelter state. So yes, we have great care, but we have bad housing. So it's a mixed bag, but it's good that folks can get the care that they need. I've also, there's some controversial projects happening in my district. One of them is a recovery campus, the Shattuck. So for folks who are struggling with substance use disorder and are looking for a path, they're trying to create a path of continuity from being chronically homeless with substance use disorder to having permanent supportive housing. Folks are hearing a lot of different things about folks who are using opioids. If you're not from Boston, there's mass incass, and the way that that's being reported in the media is impacting people's perceptions. And I found that when you're dealing with things like that, having a one-on-one conversation is the best way to kind of dispel those perceptions, because people rarely talk to you in person the way they talk to you online or through email. And having them in groups, if you are able to go to your communities and offer your time and say, this is my expertise, I'd love to sit down and kind of dispel any concerns you have or talk you through an issue you have, is kind of the best way that I found. I come from organizing as a background, and that's still what I think is one of the best ways to kind of shift the needle in my community and to kind of have those conversations. Maybe we don't get to a place within those 6 months, but like in a year, I've built trust with them. They're willing to hear what I'm saying, and suddenly it's a different conversation. It's not like I don't think that that's appropriate care for a child, to suddenly, okay, maybe that's not what I would want for my child, but I understand how other folks could want it, and kind of opening up that bridge is important. But like on a bigger structural level, I'm not quite sure how we address that. To me, it's still really micro in those small conversations that I'm addressing it.
All right. So in the migration front, I will also add, it's a little complicated. So just as some states have bans right now that are coming into play, some states also have provider protection laws, such as Massachusetts. And what we're seeing actually, because of that story and stories like that you sort of like described, a lot of families are looking to states that do have provider protection, so that way they know that suddenly in a year, 2 years, there's not going to be a ban put in place. So that now has narrowed down the number of states that people are migrating to. And so, for example, this legislative season, we didn't get a provider protection ban in Rhode Island, and we're seeing less migration to Rhode Island than what we're hearing in terms of people migrating for care to Massachusetts. So there is a little bit of some shifts in that, and that sometimes enters even into the political debate about, well, do we do a provider protection bill? Will that now have people coming into our state? Like, what does that mean? The other piece about that too is that in the people that I've seen that have migrated, many of them are very well off, very well resourced, and it makes me very worried about people who don't have the ability to do that and who's being left behind. And some of the other things, I think that, so I think one of the big things to remember is that gender affirmative care, especially when you're talking about younger people, kids, adolescents, and young adults, is really first and foremost about affirmation. That's the goal, that's the end. It's allowing that person to feel affirmed and safe and supported in the environments that they're in. Often the debate will turn immediately to treatment, to hormones, to things like that. And I think that while that may be a means to the end for certain people, it's not necessarily what everybody wants. It's not necessarily where the conversation needs to begin, and it's not where it's going to get to eventually. And so I think when families come in and they're really nervous about all of those things, it's important to bring it back to the beginning about the fact that this is about support, this is about understanding, and then remembering that small steps matter. That family acceptance project out of California did a lot of research on this, that even small ways that parents can demonstrate increased support really does matter to the long-term outcomes of the youth in that family, LGBTQ youth in that family. So I often start with that first appointment being like, Mom and Dad, I know this is difficult, but you're here. And even if you're not engaging much in the conversation, even if you can't talk much because this is so overwhelming, you're present and you're here, and that actually means something to your child. And then build from there. So start with the small steps and just build. And the other thing that we know from the research is that family support is one of the most important resiliency factors for this population. So while it may take more time to bring the family on board, that actually is really, really important. And if it doesn't happen, then you might look at more sort of chosen family. There might be larger issues to sort of get at in terms of the home environment and things like that, or other environments where you may need to help that child, that adolescent get support. But for the most part, just take one step at a time. I think that really does help. And then I think the other thing I do think is just in terms of messaging, the big thing is, as I started to talk about at the beginning and just sort of circling back to it, one of the big messages we have with the AAP is really that there's no real place in the clinical practice, for politics. That really we want to protect the sort of sanctity of the doctor-patient relationship, of the clinical environment, as a place where a patient can come in and talk about their concerns, and we're really going to take that into consideration, trying to build an individualized, nuanced sort of treatment approach, and that's no different for gender care. Nobody's ever locked into a certain pathway. If something's not working, especially if a child's young, we need to rethink that, and we need to back up and say, what do we need to do differently to affirm you? And that is a very personalized question. It's not something you can legislate on, a state level or a national level. So I think that's always really important, and just, in terms of engaging with larger systems, always an important message to remember. And then I think the last thing, just in terms of what you can do, I actually think the most powerful thing is in our day-to-day interactions. If conversations come up, among friends or among family, or you have a colleague, or you encounter somebody who's LGBTQ and they use pronouns that you're seeing other people are not using, whether it be speaking up or using that person's pronouns, I think the best thing we can do is actually lead by example, because that's really where change happens. You see it in your friends, you see it in the sort of groups, you see more acceptance, and you're going to take that on. If it's a public sort of debate, that can get really sort of polarized, and I actually don't think much change actually comes out of that. I think it's actually in our smaller environments and smaller communities where this is, and I actually even think a lot, someone was talking about since 1994, I think a lot of the reason there's been change is because among friends, we now know more people, and more people are out as LGBTQ, and we see each other affirming that and creating space for it, and that has actually led to some really significant cultural change over time. It's slow, but I think it's most impactful.
Great. I really recognize we're at time. So I just want to thank our audience as well as our panelists, and really elucidating just that gender affirming care is like any other form of healthcare, and it really allows trans people to live openly and authentically. And it's really imperative that all of us really recognize and dismantle the barriers that we encounter in this field, not only for the sake of individuals, but really for the broader goal that I think we all share, as Jane Kim spoke to last night, in terms of building a society and a school that really values diversity, equity, and inclusion and justice for all. So thank you.
We have a few minutes before our next panel. We will be staying in this room. There's coffee and water as snacks outside, so please grab